and welcome to another episode of On the Go with Dr. O. I'm your host, Dr. Uchenna Onyani. As healthcare in the United States continues to evolve, it is alarming that gaps in healthcare still exist. Tonight, we will discuss disparities in healthcare as it relates to access and quality and the impact it may have on certain groups. With me this evening to discuss are two experts in their respective fields. Dr. Ada Opaya Mariaway is an OBGYN who has been featured on WJLA's Good Morning Washington, an affiliate of ABC TV, to discuss closing gaps in Black maternal health care. Also joining us this evening is Dr. Christine Thorpe, Dean of the Nathan Weiss Graduate College at Kane University in Union, New Jersey. She's also the author of Living Beyond the Facade, Inside the Health and Wealth Practices of Americans of African Descent. Thank you for joining us this evening, doctors.
Thank you.
Thank you for having us.
Absolutely. So, I want to get right into it, especially with everything that's been going on over the last year and a half with the pandemic. Healthcare disparity is a topic that has really come to the forefront. And I'm curious to know, and I'll have both of you answer. We'll start, I guess, with Dr. Mariway first. Do we, in fact, have a public health crisis as it relates to healthcare disparity?
So thank you again for having me on. I think this is a very important topic. I think you've brought to light again that in the past year, racial inequities and disparities, particularly in healthcare, have been highlighted. So to answer the question, is this a public health issue? I'll first start by saying that the COVID pandemic has brought social and racial injustice and inequity to the forefront of public health. And when you look at data on race and ethnicity, for more than 90% of people who died from COVID-19, we see that the percentage of Hispanic or Latino, non-Hispanic Black, and non-Hispanic American, Indian, or Alaska Native people who have died from COVID-19 is higher than the percent of these racial and ethnic groups among the total U.S. population. So I would definitely say that in and of itself is a public health crisis. I'm an OBGYN, and so I see firsthand the inequities in Black maternal health. And just a couple of stats for your viewers and listeners. Women in the United States are more likely to experience complications during pregnancy and childbirth when you compare to other developed countries. And of those women, Black women in America are at least 3 times more likely than white women to die as a result of pregnancy. When you look at states such as Illinois, that risk actually increases to 6 times greater. This transcends education. It transcends socioeconomic status. The National Academy of Medicine released a report back in 2005, 2006, which basically concluded that racial and ethnic minorities receive lower quality health care than white people, even when you control for insurance status, income, age, and severity of conditions, when you compare all of that. So I would say, based on these stats alone, and I'm sure we can discuss them all night, all of the different statistics that have come in the past 10 years, I would say, yes, this is a public health crisis and one that needs to be addressed sooner than later.
Thank you. Dr. Thorpe, the same question to you.
I'm in full agreement. The mere fact that Governor Murphy recently signed legislation requiring maternal health care professionals to get implicit and explicit bias training is a clear and present sign that we have an issue. I'm really appreciative of this governor's administration's efforts in really focusing on maternal health in particular. But yes, across the board, health disparities are real. For racism to be labeled by the American Public Health Association as a public health crisis, and we're hearing this, sadly it's 2021, but gratefully we are hearing this. The fact that racism is being labeled a public health issue speaks to the bevy of issues that we've been experiencing for many, many years, but also bringing it to light that it is past due and in rare time for us to actually begin to address these issues head on, pass the lip service and actually engage in meaningful activities, programs, and services to truly dismantle the systemic oppression, racism, and disparities that we've been experiencing as it relates to our health issues. And when we look at communities of color across the board, there are a number of issues that have gotten in the way for whole groups, whole communities to move forward in a healthy way on par with those who actually have full access to resources. So, it is a health issue, it is a crisis. It is one that I'm really grateful for the opportunity to talk about and to champion positive efforts that are currently taking place, because my hope is that those who are hearing it will chime in and do more and take further steps and also begin to reflect on ways that they too can begin to make change beyond just saying it's a problem, but doing something about it.
And just to add on Dr. Thorpe's points, which I wholeheartedly agree with, legislation is important, right? I mean, I think there's a lot to be said about coalitions and grassroots efforts. But if our leaders and our legislation doesn't take a stand, then the rest of our communities won't. And so I also agree that, to have governors and to have our legislative leaders come to the front of this issue as a public health crisis is important. I know that there's a push in Congress to pass the Black Maternal Health Omnibus Act of 2021, and they've been working on this for a while, but to see that there's a more reinvigorated effort in the past year, as we've seen the inequities within COVID, tells us that legislation is important, and having the people who make the laws and write the laws, who set the standard of what we consider normalcy in our society, I think that's a very, very important piece of the puzzle.
And thankfully, we have Vice President Harris in place, who's a major champion and supporter. So I believe that this legislation will move forward even more quickly and be able to be disseminated properly across our nation so that we can actually see and witness this change now and not wait for another generation in hopes of seeing the change happen later.
Exactly.
Absolutely. And, I think you both bring up very great points as far as why and how this disparity in healthcare is actually being addressed now. I've always had this question because, when we talk about lawmakers, many of them don't have the training that you both have when it comes to both the clinical side of things, the educational side of things as it pertains to healthcare. If you were in the room writing or helping to write some of this legislation, I mean, what factors, and Dr. Thorpe, I'll start with you, what factors do you think have shaped the reasons for ethnic and racial disparities, and how do you think they can be addressed in this hypothetical bill that we are talking about right now? Not necessarily one that Congress is working on, but if you were to be working on a bill to address these healthcare disparities, we all know that there are factors that lead as far as to, these different ethnic and racial disparities. What are those factors and how do we address them?
And I appreciate this question as someone in higher education. Mm-hmm. And oftentimes, I'll get to the response, but I wanted to add this little caveat here. People who are in higher education and academia, we do the research, but we never get to see it applied to policy. And I'm really grateful that we have a new policy institute at Kane so that the work that we're doing in our research environments now gets to be applied in real-time environments by moving it towards policy, seeing it in action. So it's one thing to say we want to do this research study on the impact of stress, the impact of socioeconomic disparities, the impact of lack of access to transportation and resources, and then come up with the findings and publish it in an article. It's another thing then to take those findings and say, okay, how do I make inroads with policymakers so that they see what we've done as more than just a research study, but an actual real-time documentation that supports the reasons why these policies need to move forward. So, as I mentioned, the stressors that we're living with day to day, racism, the idea that you, in your body, in your experience, in your lived space, you leave your home knowing that you are going to be facing some level of assault micro or macro, just by the mere fact of who you are, what you look like. These are pieces that policymakers may not pay attention to because these are subtle experiences that impact us mentally as well as physically. Impacts our desire to even go out and ask for assistance because we're already thinking maybe I may not fit in here. I may not get the support because I'm being prejudged. So it's being able to create those safe and welcoming spaces, which is why, implicit and explicit bias training is so critical, but also understanding the socioeconomic barriers that get in the way. How am I going to get across town to these facilities for support? How am I going to actually pay for the medications that I'm being asked to purchase because I need this for my care? How am I going to get access to quality, nutritious foods, not just anything in my community? Because, the term is no longer food deserts, but food swamps, because there's food, but what quality are we having access to? How then can we work with policymakers? Is by showing them through our documented research and our work that we do on the research end, on the academic end, ways in which these solutions can be potentially applied, as well as giving them some statistical resources to be able to move forward when they're documenting and creating these policies for us to see the actual change. So I think they both go hand in hand in being able to show the proof, which we have, but being able to give them something to work with in terms of documenting and creating a larger platform to stand on and speak to when they're speaking to their colleagues and speaking upwards in front of other officials to make these changes happen.
Wonderful, wonderful. Now, unfortunately, we only have about a minute left, and I want to give Dr. Mariaway enough time to also respond to that question. I think that it's something that needs to be addressed because when it comes to shaping policy, we have to understand where we came from and why we're in the space that we're in currently. Because if we're not addressing the factors that have led to the disparity, I don't know if it's going to be addressed correctly. Moving forward. So I think everything you said, Dr. Thorpe, with regards to academia and the role that plays in policymaking and the essential role that it plays, I think was a very good point that you brought up. But with that, I believe that we are going to take a short break. And when we return, allow Dr. Mariaway enough time to be able to respond to that. So you are on the go with Dr. O, and we will be back in the next few minutes. Welcome back to On the Go with Dr. O. Tonight we are discussing healthcare disparity in the United States. And with us this evening are Dr. Ada Opaya-Mariaway, as well as Dr. Christine Thorpe. And we've been discussing factors that have shaped the reasons that we have ethnic and racial disparities and how those factors should be addressed when forming policy to help combat healthcare disparities in the United States. And we want to find out from Dr. Mariaway, just before the break, we got a wonderful response from Dr. Christine Thorpe as far as the factors and what should be addressed in policy. And we'd like to get Dr. Ada Opaya-Mariaway's take on the factors that have led to healthcare disparity and what can be done with regards to policy to address that. Dr. Mariaway.
Thank you. And, I'll just say, to Dr. Thorpe's previous point about kind of this downstream effort and collaborative effort from research to policy, taking it a step further to the actual clinical practice. I think, what that brings to light is the importance of collaboration. I think that we operate in different silos. And whenever you look at a system that works in a silo, that system's over there, this is over here, you're never going to accomplish a large feat. So, it's important, I think, as we move forward to figure out what are ways in which we can improve on this issue that has been, plaguing this country since its, origin. We need more conversations amongst different aspects of the science world, um, research, legislation, clinical. It's very easy for me as a provider to come into the office and see my patients and do my own thing with my patient. But having a collaborative environment and atmosphere where we have this constant stream of information coming from the researchers, coming from what's going on in legislation, and then communicating that to our clinicians and back and forth, having this very tri-directional flow of communication and collaboration is important because, it's great to have the research and it's great to have the statistics. But if your clinicians have no idea that this is a problem, our patients are seeing the physicians, and they're the ones who really need to understand this information. So I think more needs to be done when we talk about legislation. Implicit bias, yes, but even just establishing more of a collaborative environment for learning. It's very easy to say, well, I'm a clinician, so I need to learn, have continuing medical education on my field. I'm a researcher, so I need to just focus on, getting the data out in the field. How about we bring the researchers to the offices? How about we bring the clinicians out into legislation and see what are the doctors saying about this? What are the things that we need? And while it's great to have legislators who are at the helm of writing these, a lot of times the physicians see this firsthand and can say, you know what, this is actually more of a priority. This is a bigger issue. So I think it's important for us to understand that in order to tackle this is a huge problem that cannot be tackled by one science community alone. It has to be multiple people looking at the data at the same time, synthesizing the information, and coming out with real-time solutions that can affect the patient in the office today. So I think it's important, to impress upon everyone what Dr. Thorpe said about kind of this collaborative community in science and that downstream effect, but making it more collaborative than it has been, so that we can see real-time effects, sooner than what we've seen. But to go back to the question of, what are the things that are driving this inequity, I think Dr. Thorpe touched on them earlier, but just for me to piggyback on them, access, right? Geographical access to care, depending on where you live, could determine if you live or die. And that's horrible. Think about COVID. Think about the COVID pandemic. Think about the ability for patients and people in general to be able to get emergency services to their home, to be able to go to the nearest hospital, to be able to find a physician, in maternal health, having access to an OBGYN, depending on where you live, that could be really, really hard. And when you think about African American women in general, when you think about Black and Brown communities, that's only represented in 5% of physicians in the United States. And so, when we talk about comfort, when we talk about communication, when we talk about cultural differences, when we talk about shared decision making, there's a lot that goes into talking to someone who looks like you and understands where you're coming from.
Absolutely.
And so I think, having that implicit bias to understand, Dr. Thorpe talked about the socio economic issues as well as social determinants of health, right? I
Dr.
stress.
Mary, not to cut you off, I apologize, but you have so much information. I wish this was an hour-long show, but
Sorry,
no,
I'm passionate.
it's great. We love the passion. I mean, you mentioned a couple of things actually, piggybacking off what Dr. Thorpe said that I kind of wanted to get to before we had to leave this evening. One of the things you mentioned was access. You being an OBGYN, what is it that you've seen with regards to women facing issues as far as it comes to gaining access for quality services, particularly OBGYN?
Yeah, and especially in the pandemic where a lot of places were shut down. Think about a majority of Black and Brown communities who rely on bus services, who rely
Mhm.
on alternative ways to get transported from one place to another. And so we saw during the pandemic that, women were stranded.
Mhm.
Pregnant and stranded in their homes because they couldn't find a way to get where they needed to go to. But access doesn't just mean transportation. Access means access. So, what are ways in which I can communicate with my patient without my patient having to come to see me? And I think that speaks to economic issues as well as social determinants of health. We have learned, fortunately, the silver lining during the COVID pandemic is we could do a lot of stuff virtual. But even with that, how many of our patients have access to internet services? How many of our patients are able to log in to a virtual appointment? But it's still a start. It's still something that can help us tackle, even if it's a telephone appointment where I can actually call and ask my patient, how are you feeling? Is the baby moving? What issues do you think you're having? That's still access. And so I think, when we as clinicians and researchers are looking at ways to really improve upon this horrible, horrible crisis that we're dealing with, we have to think outside the box and we have to use some of the learnings from this COVID pandemic to grow as a scientific community and to make sure access is more than just a bus or a car or a train or a plane. How can you reach me that best suits you? And I think having that conversation and understanding where patients are coming from is the first step.
Absolutely. And let me ask you, Dr. Thorpe, one of the, and I know we've been, talking about the pandemic and how the pandemic has really brought a lot of this to light. One of the other things, Dr. Thorpe, that has been discussed is the mental health aspect, how people have gone through depression, have gone through issues with regards to just their mental well-being. And I know mental health was a big topic prior to the pandemic. And so, Dr. Thorpe, my question for you is, as far as mental health is concerned, what are some barriers that are being faced either pre-COVID or now during the pandemic?
And thank you for that question, Dr. Mirway. As you were speaking, my answer to this question actually came to mind. I'm thinking also about those women post-pregnancy who are experiencing, postpartum depression. And I was brought back to 2013 by that woman who drove from Connecticut with her child in the back seat to the White House, believing that Obama was speaking to her and having these ideations, and was sadly killed.
Yeah.
And the question was, could there have been some help for her? And the news reports talked about this woman was deranged. And when they talked to her family, said she was going through postpartum depression. Something that, not too many Black women I'll speak to, because she was a Black woman, will speak about. Going through postpartum depression, you'll hear, well, your ancestors went through a lot and had babies. You should be able to handle it. And what I'm grateful for that I've seen through this pandemic, I was grateful to see more people of color, at least in the circles that I've been in, reach out and ask for help. I spent a lot of time giving referrals and saying, okay, I'll get an anonymous message. Somebody I know needs some help. Okay, give me some parameters and I'll do a referral. And I have my handful of therapists that I'll refer to and say, I have another client referral for you, because it's very real. And I was grateful that mental health was spoken about quite a bit during this time, and to an extent where it became a little bit more normalized among, I would say, I guess, the more recent generations, and perhaps some of the older generation that might not have been comfortable with it, seeing that people are talking about it and maybe privately seeking out help. I was glad that was happening. The fact that there were virtual groups of people doing yoga as a means of reducing stress and breathing and meditating, in an effort to help people feel connected through the technology, but also be able to release some of the anxiety and stressors that they were experiencing being locked up in their homes. It has been very difficult for people. Mm-hmm. And I think among our communities, we need to continue to push past these stereotypes and barriers that we embody. And then also the communities, the mental health community may see and misunderstand as a type of cultural behavior that is out of the norm, but not understanding who we are culturally, linguistically, to be able to sift through that information and see that this is a cry for help. With racism and experiencing on TV an observation of someone being murdered simply because of what he looked like and not for any other reason, and watching that over and over again, you're being re-traumatized. That mentally touched everyone, but more so people who could see their uncle, their father, their brother, their son in that gentleman.
Absolutely.
And it was heartbreaking and something that people really needed help with. And when the whole message, ask your colleagues of color how they're doing to see how they're doing. Well, that's nice. I was looking for more of that next step.
Correct.
Of how are we going to really dismantle this and have real conversations and provide support across the table in the same room, not for only those of us who look like, are sadly are the victims that we've watched over this past year, but those who don't look like us, and saying, I have some empathy. I feel the pain. I may not know what this feels like personally, but this was horrible. What can I do? Absolutely. Please teach me and show me the way to help and support.
Absolutely. And I wish we can discuss this further. There's so many more questions I have, but unfortunately, I'm getting the wrap it up sign. And so we're going to have to leave it here for right now, but I definitely want to get both of you back on. I want to thank both of you so much for being on the show this evening. Very informative and very helpful for some people who may not still understand what's going on right now. You have been on the go with Dr. O. We thank all of you for watching our program this evening. We hope that you watch our next episode. Take care, be well, and God bless.